and welcome back to Diabetes Medication. This is a special module of our Diabetes Eating and Wellness course. We're back here with Dana Stallings, our favorite endocrinologist. We're excited to hear about this drug class. Dana, take it away.
Yeah, so we are talking about the Amylin drug class. We only have one medication in this class. It's called Amylin or pramlintide. It is one of the more expensive medications, and because of its side effect profile and the frequency with which you have to take it, it's not something that we use often. What is very exclusive about this particular drug class, though, is that it is the only other medication that is approved for use in type 1 diabetes other than insulin. So Amylin slows the food moving through your stomach and blunts the increase in blood glucose after meals. So amylin is a hormone that is naturally existing in your stomach. And so when we eat something, your body, among all the other dozens and dozens of hormone responses that eating produces, it's also releasing amylin so that it is reducing the amount of glucose that is absorbed in your stomach from the food that you're eating, and it slows down how quickly it absorbs it so that instead of your blood sugar going straight up and then straight down, we have more of that rolling hill effect because your body is absorbing the glucose from your food more gradually versus quickly. And a big part of that control is from your amylin. However, in diabetes, it tends to be a little bit lower in patients. And so a lot of the clinical trials nowadays are looking at trying to include amylin in with insulin injections, because when we eat naturally and insulin hormone is released, the amylin hormone is released right along with it. And so for improved glucose control, amylin certainly helps us, but when we are using the synthetic or the man-made medication form, it tends to cause a lot of GI issues. So nausea and vomiting, also stomach bloating, flatulence, burping, and this medication should be taken before each meal, or certainly to be most effective at least twice a day. And so for patients who are already on injections, in particular patients who are on insulin, adding additional injections to their day just isn't too desirable, in particular because if you do it with each meal and then you get this profile of side effects where you just feel rotten every time you eat, then you're not really going to take it. It can also create headache, hypoglycemia, low blood sugar, if taken alongside insulin, because of how the method that it works. It's reducing that glucose release so that your blood sugars don't get quite as high. And so severe hypoglycemia can be an increased risk for patients taking this medication. But if you're taking it on time, take it about 15 to 30 minutes ahead of your meals, and make sure that you don't skip meals and you certainly don't eat smaller meals than what you had intended, especially if you're taking amylin in conjunction with mealtime insulin, then your risk for severe hypoglycemia is going to be lessened.
Okay, great. Thank you so much, Dana.